Healing our wounds is a figurative and literal process, and those with diabetes require extra care. Here to explain more is registered nurse and wound expert Dana Manusco. Thanks so much for joining us this morning.
Thank you for having me.
So tell me, what kind of foot problems do diabetics have?
Well, diabetics have two main problems. Number one is they lose the protective sensation in their feet. And so a lot of times they don't feel heat, they don't feel cold, and they don't feel pain a lot of times. And so this can lead to calluses, blisters, foot deformities, things like that.
So those are some of the signs and symptoms, but as you're walking, is there anything you're going to notice or a complete life change right away?
So it usually starts gradual. A lot of times people will notice pins and needles, tingling type sensation in their feet. Sometimes they'll get shooting pains. Some people lose, like I said, they completely lose sensation in their feet. And so,
you know how it is though, most of us are like, oh, it'll be better tomorrow. When is it really time though to see a doctor?
So if you've had an open sore or cut or wound on your foot for anything more than a week really, and you have diabetes, it's really important to get evaluated and treated, because that small cut or wound on your foot can lead to an infection. You know, your feet are a perfect breeding ground for bacteria. If you have high blood sugar, it's dark, it's moist, bacteria like that environment. So
you were talking about treatment. What are some of the treatment options that are available?
So we always like to say we have to treat the whole patient, not just the hole in the patient. So treatment really begins with a comprehensive assessment, finding out what's the underlying cause of the ulcer, finding out if it's poor circulation, if it's lack of sensation, if your nutrition is poor. Once we find those things, then we come up with an individualized treatment plan.
So when we all go ahead and outline some of the just a diabetic foot care, just really the guidelines and the prevention suggestions, and we can maybe go through them in our head, but what are some of them that we need to know about that we really need to follow?
For prevention of foot ulcers, it really, number one, the summer's coming. Don't go around barefoot. You know, everybody wants to kick their shoes off. Summer's here. Yay, we made it. No, that's the worst thing you can possibly do when you have diabetes. So to prevent a foot ulcer, making sure you're wearing a really good fitting pair of shoes is important. Making sure you're going to your podiatrist regularly, inspecting your feet daily, taking a mirror if you have to look at the bottoms between your toes and things like that. That's really prevention at its best.
Wow. All right, so you have a Lunch and Learn series.
We do.
Sounds interesting. Tell me more.
Yeah, so it's Wound Wednesday, we call it. It's the first Wednesday of every month. It's from 12 till 1. It's in our lobby at GBMC at the Wound Care Center. So we talk all about different types of foot problems, wound problems, how to exercise with your wound. It's really a forum for other people that are going through similar problems to how to get treatment, get some education. How do I fix this? How do I prevent this? And www.gbmc.org/wound RSVP is where you can register, or you can call our phone number, which is 443-849-HEAL. And you can register there. You can come to one, or you can come to the whole series. We'd love to have anyone that wants to come out.
Which is incredible, because this is something that you don't always think about, but really so important. And, taking that first step just towards help certainly could even just start with a lunch. So thanks for joining us today.
Thanks for having me.
Of course.